Good evening and thank you for joining us. It's a big week ahead for the nation's pocketbook. The federal government is finally preparing its first fiscal update since the global pandemic began. Ottawa went into this health crisis in the red, and that deficit will be bigger. We're learning that recipients of old age security and the guaranteed income supplement will see a one-time boost in the coming days. But the federal government has been spending on other Canadians and businesses as well to keep the economy afloat. Our chief political correspondent, David Akin, breaks down the political calculus of the government's financial plan.
For many seniors, keeping safe during this pandemic has come with additional costs. A switch from public transit to taxis, delivery of food instead of grocery store trips, increased visits to the pharmacy.
We saw seniors facing increased costs as a result of the COVID-19 pandemic, and we wanted to support them in those additional costs.
And this is the week that support will arrive. A one-time payment for those receiving old age security of $300. Guaranteed income supplement recipients will get an additional $200. And it will be automatic. Seniors should hang up on anyone who phones them up with offers to apply for this money.
Don't fall, prey to those that may be calling, telling you need to reveal some information to get the money. It's coming automatically and it's tax-free.
But help for seniors and for everyone hit by the pandemic is taking a huge toll on the federal treasury. Payments to seniors, $2.5 billion. The Canada Emergency Student Benefit, $5.9 billion. The Emergency Wage Subsidy, estimated $56 billion. And then there's the CERB, it's the big one. The Canada Emergency Response Benefit, likely to cost $71 billion. Those, plus other programs, mean the deficit could clock in at $256 billion. On Wednesday, Parliament will reconvene so Finance Minister Bill Morneau can provide some details on those numbers in what the government is calling a fiscal snapshot. Conservatives say it's a fiscal selfie tinged with red ink.
We need the government to tell us next week, how big is the deficit? How big is the debt? Stop hiding the mess.
Experts say one thing is for certain, there is no quick fix for this mess.
That is going to take many, many years. It might be upwards of a decade before they get the deficit eliminated and start paying down the debt.
Conservatives also want more money for the Auditor General. They say the number of audits has been halved over the last decade, even as government spending has doubled. And that's because the Auditor General's budget has not kept pace. And in a minority parliament, a commitment to more oversight is the least the governing Liberals should expect if they want the opposition to support their spending programs. Robin?
David Akin in Ottawa. Thanks, David. The only way to kickstart economies is by opening up, but by doing that, there's a bigger risk of contracting the virus. On Prince Edward Island, which hadn't had a case since late April, 5 people have now tested positive. The province recorded 2 new cases today. They're close contacts of one of 3 new cases reported Saturday. It's the first week of the Atlantic travel bubble. The new cases aren't connected to that. The province's chief public health officer says it is conducting contact tracing, and right now there's no indication of an increased risk, but to remain vigilant.
We are experiencing a cluster of 4 cases that appear to be related to travel to Nova Scotia and contact with an individual who had recently arrived from the United States. But this cluster of cases is a clear reminder that COVID-19 is still very much present in our province and we must remain vigilant.
In the coming weeks, Canada's public health officials hope to get a better picture of the actual rate of infection in this country. 40,000 blood samples collected since May are now being tested for COVID-19 antibodies. These tests can determine how many Canadians have been infected. More than 105,000 people in this country have tested positive since January. But experts say that number could be 10 to 20 times higher because not everyone has been tested and not everyone shows symptoms.